Hi, ladies. Welcome back to the show. I'm Roxann Klepper, and this is Brick by Brick. Now, I told you a few episodes ago about my ongoing health journey and that I wanted to bring more info to the audience. Well, today we have a great guest, and her area of expertise is something I'm very passionate about: the colon. It sounds funny because no one ever talks about their colon or their poop, but ask anyone at my Remax office. I love talking about this shit, literally. And so does Sam, which is why I'm so excited to have her on the show today. Sam is a registered nurse and has seen it all, but she also has extensive training in colon hydrotherapy, which she's going to explain to us. She is the owner of Rewind Wellness here in Red Deer, and having experienced Sam's expertise firsthand, I can say that this is going to be some amazing info for everyone. So let's dive into it. Hi, Sam.
Hi,
Welcome to the show.
thank you.
So, why don't we start at the beginning? Why don't you tell us a little bit about colon hydrotherapy, what it is?
So, colon hydrotherapy is a process of rehydrating, retoning, re-educating the bowel, the large bowel or the colon. That organ of the body has multiple different names, but it is the end of the gastrointestinal tract. And so the gastrointestinal tract starts in your mouth. Most of us are really good about keeping our mouth clean and doing our hygiene, but we forget about the other end of the digestive tract, the colon. And so, similarly to brushing your teeth or changing the oil in your car, you want to consider giving yourself a colonic or coming to see a practitioner like myself who can assist you in the process of giving yourself a colonic or a colon hydrotherapy procedure.
Okay.
It's a simple process
Okay.
where you would come to the clinic and a small rectal speculum is inserted. It doesn't hurt. It feels just like some pressure. Everyone is very surprised to feel for themselves the lack of pain, I guess. And so once that rectal speculum is in place, we just alternate through a series of fills and empties with filtered, temperature regulated, UV sterilized water to get the colon to start doing the flush and release.
And so I have done this with Sam before, and it was fabulous. I love doing it. Honestly, I really do think it makes a huge difference. And so, who is a procedure like this for? Who should do it? Who can do it? Who can't do it?
Yeah, so colon hydrotherapy benefits a wide range of individuals, those looking to improve their digestive health and detoxify their system and just support their overall well-being. People who've got digestive issues, chronic constipation or frequent diarrhea, people who struggle with bloating or gas, especially discomfort after eating, if you've got a diagnosis like irritable bowel syndrome, and then people who just have like low energy and fatigue, maybe they're struggling with frequent colds and flus and need to boost their immune system or open up those detox pathways. Colon hydrotherapy, also in countries like the UK and Australia, is the preferred method of preparation for the colonoscopy procedure that most people over the age of 55 to 60 start doing just in terms of like preventative health screening.
Right. And so, while you brought it up, let's just talk about the preparation for our colonoscopy here, which when I was at your office the other day, you and I sort of talked about is it really the best way to sort of clean out your colon? That the drink that you got to drink full of chemicals, and does it really do the same thing as colon hydrotherapy?
Yeah, it actually has some detrimental effects in terms of time. It's taking you anywhere from 6 to 12 hours to have effect from that liquid laxative you're meant to drink. You feel unwell in terms of some nausea and some cramping. And again, you can't really leave your house during that 6 to 12-hour period because you're constantly running to the toilet. And people can be left feeling quite depleted and dehydrated from that aggressive diarrhea that is induced. cleaning out both arguably the small and the large intestine as that liquid laxative is working its way down the system. The alternative colon hydrotherapy is it's really only a 45-minute, maximum an hour procedure. It works to rehydrate the body. You increase your circulatory volume with the sterile water that's going into your body. And you maybe have some discomfort with abdominal cramping as we're removing the waste, but nothing to the extremes that that chemical laxative can induce. And your time you're saving is huge in terms of using a colonic for preparation to go into colonoscopy.
And in terms of like actually doing the same thing, so yes, I understand that the colonoscopy drink's gonna flush out, the last few days worth of poop out of your colon, but when I do the colon hydrotherapy, I see stuff come out that I'm like, I haven't eaten that in a week. Where
Right.
did that come from? So
Yeah.
to me, like those don't even seem like they're the same thing.
Right. And the colon hydrotherapy has the ability to get into little pockets and crevices that are deep within the bowel and get matter to release from those sticky spots. Where the chemical bowel movement that's induced from that liquid laxative doesn't give your colon that full peristaltic contraction, encouraging release of waste from all of those little crevices and cracks where things can really get stuck. It's more of just a chemical diarrhea type of flush versus a true retoning, re-education of that proper contractility to that muscle.
Okay. Yeah. And so while we're on this topic too, social media. If anyone's been on social media lately, right, there's a new craze out there and it's parasites. Right? It's everyone's doing a parasite cleanse. Everyone wants to talk about parasites, which is lovely. You and I talked about it when we were there. My doctor told me I had some parasites. I had done a parasite cleanse, which is why I wanted to sort of flush some stuff out. And so what's the parasite deal? How many people are dealing with parasites and why is colon hydrotherapy almost a must for anyone who is doing a parasite cleanse?
Mhm. When we talk about ourselves as humans and we talk about the microbiome, we are actually comprised of more bacterial cells than human cells. And so, in terms of the microbiome, we all have parasites. That is part of what makes up the microbiome. Good bacteria, pre and probiotics, pathogenic bacteria, things like yeast and parasites. You want your microbiome to be in that healthy bacterial balance. You're supposed to have 3 pre and probiotic bacterial strains to every one pathogenic yeast, parasite, or bad bacterial strain. The issue is because of our society and our culture, we've lost the concept of annual parasite cleansing. And we've done things that actually increase our risk for contracting parasites, like eating sushi, eating rare or undercooked meats, drinking water from taps, swimming in lakes, rivers, or pools, sleeping with animals or pets, and maybe not being diligent at keeping our animals and our pets up on their deworming. It's interesting when you start talking about the concept of intestinal parasites with people who are pet owners. Most of them are very aware of the fact that they should annually or biannually, depending on lifestyle, treat their pets for parasites and worms. Why are we so different than our animals, especially if we're sharing forks or beds or waters with our pets? And I've seen all of those things happen. So,
Right.
um, other things that lead to that imbalance in the microbiome, where maybe you have more bad bacterial strains than good bacterial strains, are issues with consuming a lot of processed foods or sugars that can weaken that microbiome and lead you again more susceptible to these parasite infections. And we know that processed foods are a huge issue in our society.
Right. And so if someone is consuming foods, not doing the deworming, they have these intestinal parasites, and then they do a parasite cleanse. Now they've killed them all off. But if they are eating a poor diet of not fiber rich foods, now those parasites are just stuck in the colon and they're not pooping them out either, are they?
Correct, correct. And poor nutritional habits also regularly comes with poor hydration habits. And so two things that lead to functional constipation is going to be dehydration and, yes, like you said, lack of fiber, also toxic additives and preservatives that really lead to gut irritation and inflammation, like the chemicals and emulsifiers that are in processed foods, lead you to having like poor elimination. And again, people who, you can be having one or two bowel movements a day, but if it's incomplete elimination to where you're having like dry, constipated bowel movements, I would argue you're not having proper elimination anyways. And so doing this parasite cleanse, leaving that die off trapped in the system, people, you're right, can do a parasite cleanse and end up feeling worse than they did in the beginning if they're not doing enemas or colon hydrotherapy to help the body remove that waste.
Okay. And so all a part of the really all a part of the detox process.
Mhm, mhm.
The from the parasite cleanse to the flushing it out as well is all it's all a part of the process. So if they're just laying in there dead, you could be doing your body more harm than anything.
Yeah, and whether you're parasite cleansing or not, the matter that is left in your system recirculating that toxicity leads to things like liver stagnation, gallstone formation, insulin resistance, hormone disruption, leaving your bowels to just petrify and putrefy. Leads me back to that analogy of doing an oil change in your vehicle. Eventually, you're just circulating around toxins, right? So, to
Right.
refresh with colon hydrotherapy can lead to better nutrient absorption, lead to better immune system function, lead to better hydration, and all of that results in better elimination as well through your body. So, it's kind of a positive feedback cycle there.
Right. And so I mean, I guess a ton of diseases start in the colon now too. Like how many more times are you seeing colon cancer, disease, liver cancer, all those sorts of stuff that start in there. And so if we're not helping it along, everything's just festering in there. So does that eating these processed foods, not helping it along, doing the detox process and not finishing it, are all of those things sort of contributing to these colon cancers because we're not eliminating our colon properly?
Yeah, I mean, Hippocrates, the father of modern medicine, is quoted saying that all disease begins in the gut. 70 to 80% of the immune system actually resides in the gut. And so an unhealthy colon leads the body to be more vulnerable to infections, autoimmune conditions, cancers. Again, because as you lead toxic built up impacted material sitting right next to what's known as gut associated lymph tissue in the walls of the colon, the large intestine, and a little bit in the small intestine. That toxicity absorbs right into your lymph system, and then that circulates the toxic matter all throughout the body, and that can lead to the development of things like cancer, autoimmune disorders, skin conditions, acne, eczemas, psoriasis, things like that.
And it's interesting to me that, I've had acne my whole life, very bad, cystic hormonal acne. And it was always from my doctors. We talked about this. I was on birth control for 20 years for acne, not even for birth control. I was on Accutane. And so it's interesting to me that, I would consider the regular doctor path for these symptoms is always some sort of here's a pill, here's an antibiotic. I had doctors try to say, but all of that stuff is it's not fixed topically.
Mhm. It's interesting that antibiotic is one of the biggest go-tos for those skin conditions,
Mhm.
and that, as I mentioned, is altering that bacterial makeup of your biome. And so I would caution those who are seeking relief of skin conditions from their Western medicine doctors to pause maybe before they just take that dose of antibiotic and do something like maybe a stool test or come for a colon hydrotherapy session to get a good visual of what the body is producing in terms of waste through the colon hydrotherapy. That can give you an indication of, is there a bunch of yeast buildup, parasite buildup? And so we do need to work at rebalancing that microbiome with things like pre and probiotics or fiber rich foods. Is that going to clear up your skin? Or if you're, hesitant to do the colon hydrotherapy, there is microbiome stool tests that will give you a map of how much good bacteria or what bad bacterial strains you have that are contributing to your acne. We can take that information and give you specific pre or probiotics that you can work with to help the body rebuild the cultures of bacteria that are needed to mitigate those skin issues you're having.
And so much of those tests aren't available through our regular doctors.
Correct. Yeah. Yeah. You end up needing to see like a privatized or independent practitioner like myself or
Yeah.
a naturopath.
Yeah. So interesting. Um, okay, and so you mentioned the word enema a little while ago, and I'm going to ask because when I came in for my sessions with you, I actually didn't know the difference, even though I've done this before. So tell us the difference between colon hydrotherapy and an enema.
Right. So, colon hydrotherapy, the aim of the treatment is to eventually rehydrate and remove waste buildup from the entire 5 feet of the colon or the large intestine. An enema is used either in the clinic here or at home with a medical grade silicone bag, or there's plastic buckets or glass containers as well that can be used to instill a volume of fluid anywhere from about 500 mils to a liter of fluid. And when you instill that much fluid in the colon, you're really only able to fill about the first foot and a half to 2 feet of the colon. You would retain that enema infusion of water for somewhere from 3 to 15 minutes. The body is going to absorb that hydration through osmosis. And once the colon has rehydrated itself and swollen up a little bit from that installation of water, that signals through blood flow and the nerves to start doing that peristaltic muscle contraction to kick that load of waste out of that first 2 feet or so of the descending colon. People, again, can do that at home by themselves, and that is sometimes the reason they would choose to do that versus coming to see a colon hydrotherapist. If you are really working to rectify constipation that's been ongoing for years, colon hydrotherapy is going to be an ongoing process for you. You're going to need to come for more than one session. And so, in order to keep up that work of rehydrating and re educating that colon, some people choose to do enemas at home in between their colon hydrotherapy sessions just to keep up that work. There's also the concept of using like herbal infusion blends in the enema. And the reason you would do that is because the descending colon, that first 2 feet of the organ, lays across or traverses what's known as the hepatic portal system. And the hepatic portal system is the main drainage vein into the liver. So you would want to instill a herbal blend into the colon and retain it for 10 to 15 minutes so that through osmosis, the colon is going to pull that herbal medication directly into that main drainage vein, getting that herbal medication into your liver and therefore systemic circulation in about 15 minutes. This is bypassing the stomach acid and that oral route of medication administration or herbal supplementation people usually take just by mouth, right? Then you're waiting
Right.
somewhere between half an hour to 45 minutes for the medication to be digested and absorbed and assimilated and hit your circulatory system. Using the enema route of herbal medication instillation, again, you're getting that systemic circulatory effect in about 15 minutes. So there's lots of things people would choose to instill into their colon. Probiotics is pretty self-explanatory. Things like coffee. Coffee is used to detoxify the liver and the blood, to aid in parasite and candida cleanses, and to help rebalance the pH of the colon. There's also hormone balancing blends that I use in the clinic, and some soothing blends that are used more in people who've got like inflammatory bowel conditions, things like Crohn's and colitis. And now
Right.
inflammatory bowel conditions, Crohn's and colitis, can be contraindicated in terms of colon hydrotherapy. So that's something where um, I'm really cautious in working with people. You would need to have had a relatively recent diagnosis and not be on any immune modulating medications yet in order for me as a colon hydrotherapist practitioner to
Mm,
be working with you having one of those types of diagnoses.
okay. And so I was with Sam and I did, what did we do? We did the probiotics
Yeah,
and we did a chlorophyll blend
yeah,
and we did a coffee. So we did do a coffee enema. It was fabulous. Again, for me, it was, I mean, I know this sounds so weird, but I love to see the stuff that comes out, so Sam puts the water in and then she releases the water and you see stuff come out and it's like, okay, where did that come from? Like, I haven't eaten a carrot in 5 days. How come there's a carrot there? I think it's hilarious and so sad that there's just this piece of carrot hanging out in my colon that my body hasn't gotten rid of. And so the coffee enema, then it sat in there, it did its thing, and I was amazed. You put all this fluid in, it was incredible to me how much got absorbed because way less came out than what went in. Like I thought that was amazing. Like I wasn't expecting that. That was, and so some of the, we saw some pretty weird stuff come out,
yeah.
So when you're talking about parasites and things like that, you can see those things come out, that's never happened to me before. That was very interesting.
Yeah. And
And I bet you've seen some pretty weird stuff.
another piece I just want to mention is because some people have heard of enemas before, or some people
Yeah.
have struggled with constipation and come to see us in the hospital and been given a fleet enema
Oh,
and probably had a terrible experience. And so I just want to
right.
apologize on behalf of the entire Western medical system that we are doing that fleet enema procedure to anyone because it is ineffective, it is unpleasant, and it is uncomfortable. So when I am
Okay.
giving enemas in the clinic or I'm teaching patients to do enemas at home, I am using gravity enema bags, not fleet enema bottles. That 500 to 1 liter volume of fluid is instilling slowly through a gravity drip rate. It should take somewhere between 3 to 5 minutes to even have that fluid being instilled in the body. That slow, controlled installation leads to a much more comfortable, calm session where you're able to actually retain the fluid for that 10 to 15 minutes to get that absorptive effect of the medication. And then, yes, you do still, have to release that load of water. But as Roxann just mentioned, sometimes it's not that full 500 mils or more because the body has been dehydrated and it needed to absorb that herbal infusion, right? So
Yeah.
very different.
I was so impressed with the chlorophyll stuff and the probiotics. It's amazing to me how much technology is involved and how advanced, it's not just water going in your butt. That's not what it is. There's so much more to it than that. And I find that I'm so fascinated that most people ignore their colon completely when there's all this cool stuff that you can do to it to help it.
Mhm. And being a registered nurse with 10 years experience working in the emergency room before this, my life would have been so much easier if this machine was available for me to use in the hospital. The number of failed
Right.
fleet enemas, patients on this, it's called the narcotic bowel protocol, where we're giving them oral laxatives every single day that they haven't had a bowel movement to mitigate the constipation that comes from their pain medications to control whatever disease state or process they have going on in their body. I'm not disputing they need their pain medication,
Yeah,
but anybody who's on that narcotic pain regime should consider colon hydrotherapy to keep their body detoxifying from everything that's going on.
right. And so, okay, tell us how if someone wanted to book a session with you, well, A, how do they do it? And B, what's the recommended protocol? So I booked 3 sessions in a row. It's what I've had good luck with in the past. Do people come in for one? Do they come in for three? Tell us the whole process.
Yeah. Well, if you're just starting with colon hydrotherapy for the first time, it is recommended you have a series of 3 sessions relatively close together. That can be 3 days in a row, that can be every other day. That can be the maximum I like to see is like 2 to 3 days in between the sessions. So, like a 10-day period, getting those first 3 sessions in. And that's because that first session is really just about nervous system regulation and rehydration. Majority of people that come into me are coming into me with chronic stress and chronic dehydration. Most of us are ripping around in fight or flight and very dry. So until we rectify those two situations, we don't see a lot of waste move out. And so again, that first session can just be clear water goes in and clear water comes out until we've achieved that rehydration of the body. Once rehydration has been achieved, you'll notice that outflow watercolor change, yellow, brown, sometimes even black. Then gas bubbles will move, and then chunks of solid waste start to flow out. That second session, you'll really feel the water start to enter that top transverse part of the colon and get to work loosening the really old impacted pieces of stool. And then by the third session, we're just looking to be really sure you've got the entire 5 feet of the colon cleansed and refreshed. We want the water coming out of the body at the end of the session to be clear for 2 to 3 passes, giving us the indication that we've made it that whole 5 feet around the colon. As far as booking appointments with me, you can book online via the website, which is just rewind-wellness.ca. There's a book now button. It takes you to the availability calendar so you can see what works for your schedule and book yourself in online. Otherwise, I'm available via email or phone call. My contact information is again on my website. I also have an Instagram page, Rewind Wellness, and a Facebook page, Rewind Wellness, Holistic Nurse Coach, I think is that Facebook page. And yeah, I'm really responsive on all social media platforms and via telephone. So feel free to reach out, even if you just have questions. I'm happy to offer a
Mm.
free 15-minute in person or via phone consultation if you just want to come meet me in person and see the clinic and see the equipment and ask more questions. We can do that.
Very cool. And so I'll have all of Sam's info and the link to her website and all that stuff at the bottom of my notes on the podcast. And I do encourage you just to do some research and reach out to Sam. It sounds scary, but it's not. It's not painful, it's not awkward, it's not weird. It's actually, I don't know about you guys, but when I'm trying to, on my health journey, I like to see the result. What I like when the stuff comes out that tube, I'm like, okay, it's doing something. This is worth it. As opposed to just taking pills and you're like, oh, maybe I feel better, maybe I don't. I don't know. But this is like it's instant gratification. Something comes out that tube and I'm like, that is awesome, right?
Yes. Yeah.
Like
I
it makes me
totally agree.
happy when something comes out.
Yeah. Yeah. And
Yeah,
I personally also struggled with severe cystic chronic acne all down my face, all down my chest, all down my back. I went through all of the conventional treatments for it. And I also really struggled with my mental health. I think related to that,
sure.
you never want to go in public when your physical appearance is a
Yeah,
little bit off and you're isolating yourself then. And so colon hydrotherapy and coffee enemas have not only changed my life, but I really feel they've saved my life because nothing ever in my lifetime has moved the needle on my health as quickly, as effectively, and as continually as this process has, to the point where, yeah, as a registered nurse, I'm angry we don't offer this publicly to the majority of people that need it.
agreed. I think there's a ton of people that have never even heard of it,
Oh, for sure, that too. Yeah.
right? And I think it's fabulous. I think you're fabulous. I think everyone should try it. I think it's just super important part of your health journey.
Thank you. I
Well, Sam,
agree.
thanks so much for being on with me today. It was so good. Like I said, I'll have Sam's info. Feel free to reach out to her. She's super. It's going to be a good experience for anyone that does it. Thanks, Sam. Enjoy the
Thank
rest of
you.
your day.
Yeah, you too.
Okay, take care.